Please, ladies and gentlemen, Dr. Lisa Nagy.
Thank you very much for having me. It's an honor to follow Bill Ray. I think we were a little bit like two peas in a pod. Bill fixed me, and so I'm here today because he was able to treat me and to set me on my path of recovery. And now I've been trying to change the situation in the country that nobody seems to know about environmental medicine. And why not? And it's probably because one part of it is that women are affected so much more than men and earlier, and nobody believes us. So I will skew some of my talk to personal experience and some interesting stories, and I have a lot of slides, and I'll fly through some that are more boring, maybe, and just focus on the interesting ones as we, see how long it takes me to go through them. So chemical sensitivity in the average person. This is a ubiquitous phenomenon. It is not just in the very sick who then become electrically sensitive. It's very common in the average woman over 40. So that's my selling point to medical school, is to say we need to learn this because so many people become a little sensitive as they age, and they may not know because they're wearing perfume or using traditional detergent and fabric softener, as I was. So I had no idea that this was the condition that I had. My disclosures are that I'm president of a nonprofit called the Preventive and Environmental Health Alliance, and I'm just getting things off the ground, trying to join together people from different organizations, different diseases, different motivations, to say we need to all look at the causes and triggers of disease and look at environmental causes, including EMF, and not just try to raise money for each disease separately, because that's not going to work. So the multiple sclerosis people, the Lou Gehrig's people, the Parkinson's people, the autism group, the chronic fatigue group, everybody wants money for their issue, which is not the way we need to think. So we need to promote it as a unified theory of disease and of inflammation, and then go from there and figure out what the data, what's there and what we need to produce in the future. I'm also, I don't have a commercial relationship, but I now practice medicine. So that's my big disclosure, is that I work. So I was disabled for a decade. I saw Bill in 2003. I was disabled in 2000. And I was on the dole and had Medicare and, all that stuff. And now I've told them I can work. So it does prove that if you have a disabled individual, you can get them off the dole and have them earn money and return to society if you put the money up front to cure the disease and stop the cause of it. And I need my clicker. Let's see. Okay, so what I want to accomplish today is to give you a sense of why people become environmentally sensitive to chemicals and electricity, what some of the common symptoms are that you can recognize when you go in to assess a home and you see a person exhibiting symptoms. So I gave out this flyer which has lots of words, no space, and lots of symptoms on it, and enumerates the treatments that are done in environmental medicine. So you could be an expert. You could maybe, before you trifold the trifold, you could Xerox it and maybe hand it to patients. I know it's imperfect, but it does help them understand there are other people who know about these symptoms and why they exist. It'll make them feel comfortable, and then it lists books they can read or a video that I've made on an introduction to environmental medicine, and they can be on their journey to figure out how to get well. So this is something you need to hand them, or your own version of it, so they can go find help. We'll discuss mechanisms of the problem, perhaps, tests and treatments, not everything, but some interesting tests and treatments, and how you can best serve the clients by referring them, as I said. So I gave this talk to medical students, and I used this slide. And I said very profoundly that this may change your outlook on health and medicine. And I wanted to wake them up and say, this is big. So I guess you're sort of like medical students, you're learning. This is it's a huge shift from what we think of in traditional medicine, which is, I've got a symptom, I need to stop the symptom. Do we really care if it's the chocolate cake that gave the person the headache? Or do we want to give them Furanol for the headache now? So I used to think about, did they have cashews or peanuts or chocolate cake? before they came to me in the emergency room with a headache. So I was thinking in terms of environmental triggers before I learned that I was environmentally sensitive. Some people like to think that way, and other people can't be bothered and are in a rush and just want the quickest, most expeditious treatment. They don't want to go to a meeting and learn new information unless they're paid to do it. So we need to get doctors to want to learn this. So anyway, in medical school, I was taught to believe the patient. And so now I do. Funny, my medical school, which is Cornell, wrote up an article about me, unbelievably, last month in the Alumni News, and it's called Believe the Patient. So I told the story to the interviewer, and she thought when I learned in neurology from Plum and Posner that there was a woman who was walking through doorways, and she would go like this. And Dr. Plum said, don't assume the patient is a psych patient. Try to figure out what could be causing this person's hemibolism or whatever she was doing, flailing with the arms. And it turned out the patient had a thalamic tumor. And every time she walked through a doorway, something to do with probably EMF was triggering her tumor to cause a movement disorder. And I remember that still. You know, how many, 25 years is my reunion is this week at Cornell. So wish me luck. I'm going to go back and hit them hard. But anyway, so you see, it's talking about my experience being ill from toxic mold and my view about what has to change in healthcare. And Cornell is very conservative. Yet somebody called me out of the blue 5 years after I approached them and offered to write this piece. So we're getting there. Before we get going, so briefly, my credentials as a speaker in this area. So I was trained in good schools. I went to general surgery for 2 years and emergency medicine. I was practicing in Los Angeles. I became too weak to work, and I had no idea what was wrong for many years. I almost died. I couldn't intubate. My hand was too weak to pull up on the laryngoscope, and the nurse would do the pull-up for me when I would put the tube in the ER. What I learned by becoming ill has changed my life, my viewpoint about the potential for getting to the cause of disease, and as I mentioned, I started a nonprofit. I've also been named to the CDC's National Conversation on Chemicals and Public Health, as well as a roundtable at NIH on building and health. And we're trying to get them motivated to come to meetings like this and to really learn from people who know about EMF. I have definitely explained to them that USGBC and the LEEDS criteria need to include health credits, and we need to talk about EMF in building. So I'm doing my best in that direction. I could use some help. In both organizations, we have focused specifically on mold-induced illness and the need for more government-funded research in this area because mold exposure often leads to chemical and electrical intolerance. It's very common when somebody has EMF intolerance, always think mold. It could be 20 years ago, but they had mold exposure in many cases. And it may be triggered by a recent exposure to a new computer or new wiring or sleeping next to the cell phone while it's charging for a month, but something may go back further than the EMF exposure. They may be really a mold patient. So you've got to deal with treating that condition or they won't get well from the EMF. So we're all on a continuum from 1 to 10 of being affected by our environment. No one is a 0. It's how you deal with exposures that makes you more or less environmentally ill. So look for it in everyone. And this is my big claim to fame. I did a diagram. So I see environmental medicine, or whatever you want to call it, comprehensive medicine. I said that environmental medicine is comprehensive medicine, and that it really incorporates all the principles I've learned by attending all the meetings from all these other groups. Allopathic medicine is on the bottom, sort of the support structure. And then I learned about anti-aging medicine and hormone replacement, functional medicine and metabolic issues, integrative medicine and whatever they do, autism. They all are pieces of the puzzle. We need to unify it with some term. Doesn't matter what we call it. So I call it integrative and environmental, or preventive and environmental. Something that people can understand needs to be incorporated into allopathic medicine.